We're now approximately 2 months from a bilateral decompression of the greater occipital nerves with resection of the lesser and third occipital nerves, which are in the back of her head and neck. She had a long history of severe head and neck pain. Can you tell us what your pain was like prior to surgery?
I had constant headaches off and on every day, stabbing, burning in the back of my neck, up through my head. It was difficult to turn my head left or right, to look in a reverse position, like to back up in my vehicle. Sitting a long time, walking a long time, doing any activity, my pain would grow and get severe to where I had to go home. I was almost in tears, constantly taking Tylenols or medication to try to relieve the pressure and the pain from the neck injury.
Were you on any medications that were stronger than the Tylenol?
At certain times they did prescribe Percocet at one time, which I didn't want to get addicted to, so I took it for a very short time and pretty much just got used to being in pain, as weird as that sounds. It was just something I lived with and dealt with until I had this procedure done.
And a friend of ours diagnosed her with occipital neuralgia, Dr. Kevin Crutchfield, and treated her and then referred her when her treatments were not successful in continuing to treat her pain. And so we operate on her to decompress those nerves. You're about 2 months now. Tell us about what has improved and where are you now?
My style of living has improved. I'm able to work again with pain-free without going home in tears. I'm able to move my head any direction. I'm able to drive more comfortable because I feel like I can turn my head to look in the reverse direction. No headaches anymore. I was having headaches constantly. I haven't had a headache since my surgery.
Where were your headaches?
They would kind of move around more to the side, I guess. I guess it was like more stress from the pain of being upset.
Were you having headaches in the back of your head and neck as well?
The front. It just depended on the day, I guess, the situation.
Okay. And those are gone now?
Those are gone.
All right. So how would you consider this a successful procedure?
Most definitely.
All
Most
right.
definitely.
Thank you very much.
Thank you.